The Inkatha Freedom Party hosted a two-day health and welfare summit this past weekend in Johannesburg. The summit brought together experts from various sectors, including health, water, sanitation and the environment. IFP Chief Whip Narend Singh joins us now for an update on this summit. Thank you so much for making time for us, Narend. What was the idea behind this two-day health and welfare summit?
Well, good afternoon to you, Clement. Good afternoon to your viewers. Firstly, on behalf of Inkatha Freedom Party, let us empathize with those who have lost property and possibly who would be injured in the recent the disastrous shack fire that's taken place. The purpose of the summit was it is constituency period, and all our members of Parliament from National Assembly are on this break called constituency, and we decided to reach out to communities and experts to ascertain from them exactly what challenges they face, everyday challenges that they face in society. And we focused these past 4 days on health, welfare and water issues. And we brought together in a two-day summit, as you've correctly indicated, experts from the international race relations. We brought experts from the Republic of China, Taiwan, the South African Medical Association, government, an expert, Dr. Anushka Kuvadia, who's worked in 40 countries on NHI. And we wanted to inform ourselves as a political party and also to inform the South African public of what NHI is all about, the challenges, the advantages, the disadvantages. And we also brought together experts in the water and sanitation arena from government, Mr. Ashley Starkey, who represented government. He's the head of water and sanitation in KwaZulu-Natal. Dr. Turnton, who's an expert on water and sanitation issues. And, of course, a real expert, Professor Mike Miller, who was the former DG of the Department of Water Affairs. And all of them shared with us, not only party leaders, but with audience, what the challenges are in these respective areas.
Okay. So from the issues that have been discussed over the last 2 days, what solutions have been made? What recommendations have the experts and other stakeholders who took part made?
Well, by and large on the health issue, and we know that the NHI is a current topic that South Africa is being made aware of. We know that the NHI bill was passed in the National Assembly by majority vote of 205 versus 135. The Inkatha Freedom Party was one of the parties that objected to the passage of the bill, and not because we do not support quality health care for all the citizens of South Africa, not because we do not support universal health care coverage, but because we are not satisfied with the governance mechanisms that are enshrined in the proposed bill that will give us confidence that government on its own and the minister on his own can handle these trillions of rand that will come in a single payment system and provide quality health care to all South Africans. And we say this, Clement, from a position of you and I and your viewers knowing that hundreds of millions of rand are allocated to national health, provincial health departments and municipalities to provide health care to the public out there. And if we ask the public out there, and this is what we heard in our summit as well, they are not satisfied at all with the way the public sector is providing healthcare services. I mean, we've heard of babies in cardboard boxes. We've heard of shortage of doctors. We've heard of doctors working 36-hour shifts. We heard of infrastructure that's crumbling. Now, this is all with resources that you and I have contributed to the fiscus. And this ruling party, the governing party, is not in a position to manage what they have. And now they want to take on an additional responsibility of trying to provide healthcare to all the citizens of South Africa. So by and large, except for the government representative, the Medical Association representatives and all the other 6 representatives spoke about the challenge of government not clarifying the issues of the NHI as we move forward. And as the IFP, we want to use the information that we receive in the National Council of Provinces, where the bill still has got to go to for consent, for amendment, for public consultation, to improve what's contained in the bill, so that you and I and the South Africans are satisfied that we are going into a system that's going to benefit all of us.
Mm-hmm. I imagine you also use this summit as an opportunity for you as the IFP to reflect on your role as an opposition party. How did those reflections go?
Yes, no, thank you very much. I think you are aware that the IFP in the National Assembly has always played the role of being a constructive opposition. And this we learned from the leader of our party in Parliament, Prince Buthelezi, who's been there since 1994, that you must not criticize for the sake of criticizing. You must compliment things that are done in a positive way, but where there is a need to challenge the government, we need to do so. And we feel that we need to continue playing this constructive role, but we are concerned that over the last 30 years, 29 years or so, the governing party, which is the ANC, tends to want to do things their way. And, you know, we heard a very interesting comment from one of the presenters, health presenters, a professional, who said it seems that the NHI is ideology versus vested interests. And while we all agree for the need for NHI, but we feel that our vested interests, it's too close to elections. Perhaps the ANC just wants to make an announcement like they did on the land expropriation and amendment of the Constitution. Because even there, Clement, we always believed as the IFP that there have been adequate mechanisms since 1994 for us to address the issue of land reform and land restitution. When you fail to use those mechanisms, then you want to introduce something else, so to kind of, quote unquote, hoodwink the public that we are doing something great for you. So we feel government has failed us in providing adequate public sector health services, and now they're trying to bring something which they're not even sure of themselves.
Mm-hmm. I saw that the IFP National Parliamentary team conducted this series of oversight visits in the Gauteng province. They were assessing challenges related to the delivery of essential services such as safety, security, water, healthcare, SASSA as well, the issue of grants, some home affairs officers as well, and just the overall living conditions in the townships. What did they find?
We found that on the first day, which was an outreach on the ground, we went to a police station, the Morocco police station, which is one of the top 30 police stations that have identified where there are, serious criminal offences and other offences taking place within that jurisdiction. Firstly, it covers an extremely wide area. And then we realized, and from speaking to the police representatives there, that for them to manage such a large area without satellite police stations is a challenge. Then there's a shortage of vehicles and manpower. The infrastructure seems reasonably good. We were very satisfied with the GBV desk that they have and the way they handle members of GBV. So there were positives. But I think by and large, they are under strain. They are not in a position to service all the people in the area, and much more needs to be done in terms of providing vehicles, and not only providing new vehicles, but, you know, it's a challenge at many police stations that the vehicles that they have allocated to them, if they have to go for service or for repairs, it takes ages for them to be brought back into the system. Now, this lends itself to corruption and deals that are taking place, and yet the very capable men and women in blue are blamed every time we phone the police station and say, well, come out, there's a crime here, and they don't respond. Yeah. They don't respond because they don't have vehicles. Right. And then secondly, we went to the Bakonia Mall, the Tusong Center there, to want to visit the Home Affairs and the SASSA facilities, and to our shock and horror, they were closed. And there was a sign on the window saying, well, because of no water, we are closed. Now we ask ourselves, the people who need services, ID documents, death certificates, etc., what happens to them? Surely there should have been contingency measures put in place, because I think Gauteng did very well, whether it was the province or the city, to inform people that there's going to be 4 days of no water. So provision should have been made where a public service is provided. So, but we are satisfied that the Director General of Home Affairs has assured us that in August he will be taking us personally to many of these areas to see what's happening. Today we are in Hammanskraal to see exactly what happened there, why it happened, because 29 years into democracy, you can't have people dying of cholera through the negligence of government and government agencies. So we are there today in Hammanskraal to assess what happened, what needs to be done in the future, and how we can take the recommendations of these experts and table them in Parliament before the ministers, so that South Africans can live a better life.
All right. IFP Chief Whip Narend Singh, thank you for joining us for this conversation.